Whoa.
Welcome to the Wellness Whisperer podcast, the place to heal and become whole, starting right now. My guest today is Dr. Erica Steele. Erica is a naturopathic doctor and owner of Holistic Family Practice in St. Lucia. For the past 20 years, she has taught patients and providers how to integrate biochemistry, environment, mental health, emotions, spirit, and ancestral wisdom to feel your best. Today, Dr. Steele will share her perspective on healthcare access for minorities and how minorities can be their best advocates when navigating an often biased healthcare system. Let's dive in. 6 degrees.
Yes, I do. I'm a board certified naturopathic doctor. I hold 6 degrees in my field. They're all in the natural healthcare space. So, education ranging from psychology to natural healthcare sciences, alternative medicine, public health. Those are just, some of the degrees. I'm currently in a global MBA program that I'll finish this year. And I'm also in a PhD program in international psychology with the Chicago School of Professional Psychology. So, I'm still learning and still growing. And but I think after these two, I'll be done. at least for formal structured degree education. So
Well, obviously, you're exhibiting your passion for healthcare, your passion for integrative health and wellness, which I love. We need so many more providers to step up into this area, and it's just starting to turn the curve a little bit. Can you share how you broke down barriers to become a provider? Because the statistics show that I think 5.7% of physicians and holistic providers are African American, which is so sad. How did you step over that barrier?
yeah, I think what's funny is I never saw it as a barrier. I think that's the first thing. I think it's because I have a mixed race background. And I was very fortunate and very privileged to grow up in neighborhoods that had strong educational systems. And also to my parents modeled education. Both my parents are multi-degreed, both on the master's level. My mother is in social work and is in healthcare and works with the VA, and my father is in education, and has been a teacher for almost my whole life. They both were Marines, and that's how they met. However, they then took that opportunity and used their GI Bill, and they continued their education. So growing up, education was like it was a foundation. It was how you are able to propel forward. Now, what I chose to do was very unique. My mother definitely, I think, had a lot of influence in me being a doctor. However, I didn't want to be a conventional doctor, because I saw my mother also, unfortunately, has mental health challenges. And so I really saw the inefficiencies, at least in psychology and psychiatry, in terms of patient care and patient treatment. It's heavily pharmaceutical driven, and a lot of the protocols, they're just not effective long term. And I just saw real gaps within the system. So I also really wanted to look deeper to try to understand, because I think on both lines, there's a lot of health concerns, but on my mother's line specifically, there's a lot of mental health challenges: schizophrenia, depression, mood disorders, DID. There's a lot of mental health disorders, and I really wanted to understand why, which is what drove me into more of a holistic practice, to understand all the pieces that make up human beings, which is also why I have so many degrees, because I really wanted to understand all the different facets that make up a human being.
Right. And I applaud you for that. I was having coffee with a girlfriend yesterday describing just how complicated it is to balance female hormones and how you almost need a biochemist and a scientist and a doctor to navigate that whole thing. And thank you for getting all your degrees and understanding that, rather than just saying, oh, here's some birth control pills, or here's some synthetic hormones that aren't going to help.
Yeah,
So, yeah.
exactly. Yeah. And I mean, we're even in women's care, we're so far behind. I was so shocked to learn in my public health education, that I know that there's definitely a lot of heat right now with Roe v. Wade, and people think that it was just for access to abortion. It really wasn't. It was actually access to women's health care, and it really set back a lot of our women's health care, meaning that without it we would be even less farther along, because it really triggered the health and human services. It triggered the government to study women's health issues, to include us in studies. And I was shocked to learn that women, not even women of color, just women, were excluded from studies, pharmaceutical studies, until the late 90s. I mean,
Oh
that
my.
is just crazy. And so we don't have any long-term studies on the impacts of any of these things on our female reproductive and our hormonal system, which is why it's been mostly, okay, slap birth control on it or a hysterectomy. Like those been the two options. Oh, you or maybe you need an anti-anxiety med. That's another. Like, it's like, here a
So
oh,
common.
you have hysteria, so either a psychotropic, birth control, or hysterectomy, take your pick. And that's really been the evolution. And again, like, I just was like, wait a second, there's so much more to humans than this. Stop it.
Yes,
So
yes, yes. I applaud you. Um, so you were in practice, obviously, since you've been in practice for 20 years during the pandemic. And that is
yeah.
when all these inequities and access really just got blown up. Can you describe what you saw as a practitioner with healthcare access for
Yeah,
minorities during the pandemic?
it definitely changed my perspective even more, and it definitely changed how I practiced. So, I had a practice in Virginia Beach. The We had relatively lower numbers in comparison to, let's say, larger cities like New York or things like that. So we were fortunate in that regard. However, the hospitals didn't really know how to treat, and the CDC was giving literally new information every day. So the hospitals were, and I treat a lot of people in healthcare. I treat nurses, doctors, mental health professionals. So I also got, even though I don't work in a hospital, I've been in private practice, I got a lot of feedback in terms of like reusing PPEs, and, like, they're running around chickens with their head cut off. Like, we don't know what to do, because unfortunately in conventional medical model, it's very protocol driven. And they're not encouraged to think outside the box. They're not encouraged. Now, I think a lot of practitioners tried to think outside of the box, but because the training, is very finite and linear, I would call it, they really couldn't really, I think, be as creative as, let's say, a doctor like me who has, additional vantage points in education. So the hospitals didn't really know how to treat. There was a lot of fear, obviously, on the news and everything else. Primary cares were instructed to shut down. We stayed open. I did lots, because this was back, remember, when they were saying it, the WHO was saying it lives on surfaces and all kinds of stuff. So
Right.
we did lots of, public health protocol, because of course my public health brain clicks on, and so I got pummeled. I was treating 100 hours a week, and not COVID. I was treating, really working with people who had severe anxiety, severe fear, really just wanted hand holding. And in terms of the minority communities, what I saw was just, oh gosh, when they started going into the churches and start doing different drives and things like that. And I think churches are a great access point for people. But I have a real challenge when they're paying churches for quote unquote public health service, and they're doing this in what I would consider a protected environment, meaning that, a place of worship, at least in my opinion, should be a protected environment, from propaganda or from, intrusion. And there was a lot of incentives for pastors to ensure that, their congregation was inoculated. And I just have a real issue in terms of conflict of interest, because, and I have a real issue with blanketed treatments. So minorities, we tend to be more sensitive to, synthetic drugs in period, like across the board. A lot of it goes back to our livers. Our livers just don't process. We have a lot of genetic mutations, which are all impacts from, mass genocides and slavery and various different things, which is also why I'm in this PhD program right now to study the impact of politicide, domicide, and genocide, to see and combine that with my genetic understanding and training to really understand, why this happens. So, we are also often excluded from studies, right? Women are excluded, but also minorities are excluded too. So we don't have a lot of long-term data. And so to kind of make these blanketed statements of, oh, this is safe and effective, that's a very dangerous statement when you're not actually doing full scientific process, meaning that you're meeting with somebody, you are, going over risk versus benefit, you're giving them informed consent, making sure that they understand, because there is a lot of times education gaps within the communities. And then when you offer financial incentives as well, which I also believe is a conflict of interest, that creates a whole nother dynamic that is just, in my opinion, inappropriate and unethical. And so there was just a lot of things I think that really opened my eyes up in healthcare. Not that I was like, I was definitely not unaware. I think just to the level and the lengths and the magnitude of what we saw, I think was just chilling, if I can use that word.
Yeah. Well, we'll let go of the 2020, and I pray to God that when another pandemic happens, which they say will, that we're better equipped and more inclusive and give people the option of how they choose what they choose
Yeah.
to do. So
Yeah. And I
speaking
think,
of
and really,
the pandemic,
yeah,
go ahead.
I know, and really quick, I think there also needs to be more preventative education in terms of metabolic health, right? And so all diseases begin and end really with metabolic health, right? So if your metabolic health is not where it needs to be, i.e., the food that you're eating and consuming, how you're metabolizing those nutrients, how your body is naturally detoxifying, your organs or your organ function is going to be inhibited, and therefore you're going to be more susceptible to the impacts of viral infection. And so these communities also too tend to, obesity, hypertension, hyperlipidemia, which is high cholesterol, diabetes, and a lot of it is directly relative to the food and the eating, high sodium, high sugar, high fat, and that is an epidemic all within itself. And so I think if more education is done more in the proactive instead of reactive, I think we would definitely see a significant change in the numbers.
Certainly, I agree. Would you describe in your words, Dr. Steele, the distrust that minorities have with the healthcare system? Rightly so, but what do you see? What do you hear?
Well, I think that there's a few things that I see in the healthcare system. Um, the healthcare system as we know it is largely whitewashed, right? So they're and colonized. We, as minority, I'm part Native American. I'm also part African as well. And we did not grow up with a lot of synthetics just in general. And I think most people from indigenous cultures, even like South American cultures, Mexico, things like that, Hispanic cultures, we don't tend to go for synthetics. That's not really, we're definitely more into food and herbs and using, plant medicine and using the earth. to be able to treat ourselves. And so when we go into a colonized healthcare system, those practices are dismissed, right? Where they're and me even going back way back, it was called, heathenist, barbarian, like not formal. Well, when in actuality, unfortunately, it was the Europeans who brought a lot of the diseases over from sanitation practices, and so, or lack thereof. And so, we're being forced into a system that really doesn't align with us culturally and doesn't align with us ethnically. And then what happens if we refuse in the system, and I see this I mean, I can't even tell you how often I say there's a lot of medical gaslighting. There's a lot of medical bullying, I would say. There's notations of non-compliance, and if you have children in the system, unfortunately, especially if you are a person of color, they tend to weaponize CPS as a way to get their minority patients to act accordingly. I have a case right now where this baby, 5 years old, has cancer, and it's been a very aggressive cancer. And from just day one, very dismissed. The families from Ghana, dismissed a lot of medical gaslighting and threatening CPS at like every turn, so much to the point now that they're agreeing to medical treatments that they do not fundamentally agree with or believe in, that have severe complications. And unfortunately, we're seeing those complications now. But the way that it's set up, they're afraid that their child is not going to get care, number one, or there's going to be continued retaliation, number two. And so they're having to compromise themselves because these doctors have pretty much made it clear that it's their way or the highway. And so there's a real, I would say, war going on, and I'm not being dramatic. There really is it's a silent war too, because not a lot of people talk about their experiences. And I think that's something that definitely needs to come out more, because I think if more people realized what actually happens, to people of color. I mean, he came out of a procedure, was in pain, severe pain, for a treatment that was not medically necessary, and was refused pain meds. That happens often. And that goes from a long history of medical racism where it's considered that we don't have pain. And that's just one story. I have hundreds, if not thousands, of stories, women, having strokes and being dismissed and told, well, it's just from stress, and so they come to me as a refuge because I do listen, I do hear, and I investigate. I want to get to the root cause of what it is and make sure that they are getting the adequate care that they need, even if it's not necessarily completely holistic, because I'm not one of those that's like, there are a lot of people in our space that are very much like, if it's not natural, then whatever. And as much as I would love to say that natural medicine is a miracle and does all things, sometimes if you have a fast growing tumor, that's why we have conventional practices, and I'm not going to risk a patient's life for an ideology.
Yeah, thank you. I'm so glad that you're sharing your voice on this subject matter. I read that infant mortality is 2.5 times higher among the Black population than the white. So at least that is documented, and hopefully there are committees or groups forming to turn that around. You're probably not into obstetrics, but have you seen that among
Yeah,
your patients?
I do. So I do more of like kind of a ride along when it comes to obstetric cases. More so, just a family will contract me. Either they'll come in pregnant or they'll get pregnant while under care, and they still go through their standard obstetrics, rotation or whatnot. However, I do a lot more emphasis on birthing plan, on making sure you have a patient advocate there, waiting, obviously if they're not high risk, waiting to go to the hospital, maybe considering a midwife, maybe considering a home birth, and not being in the industrialized, birthing system. I mean, my daughter is, gosh, I think she's 20 now. And I remember back, I mean, I've been in this field longer than she's been alive. And so, I remember, bringing my birthing ball to the hospital and, essential oils and all that, and being laughed at and told not to be a martyr and, take the drugs. And, the environment in and of itself is very toxic. And maybe those providers were well intended, who knows? But I just think that the overall system is very adversarial, especially if you are a person of color. There's just I think that you absolutely have to be your own healthcare advocate. You absolutely have to have somebody with you, physically, I would say, if you can, because they're starting to really frown upon, like, if you have your phone on, or that kind of thing. They don't want you to record. They don't want, they put a lot of stipulations around that. So having a physical witness with you, I think, is really important too, because I just think the whole culture. I wrote about this in one of my degrees. I can't remember which one, but I wrote about the bullying that happens in healthcare. Like, it's part of the culture. Like the attendings bully the residents, and the higher senior providers bully the younger ones, and there's just a lot of bullying in general that's accepted within healthcare. And so, of course, that's going to trickle down to the patients for sure. And so, patients, of course, through microaggressions and everything else, and the provider's bias. If the provider hasn't deconstructed their own biases, then they're going to be providing a lot of microaggressions, even unconsciously. So,
Yeah, it's almost like an educational class. We got the social class and racism and bullying, and then we got the educational class that if you're a PhD or a doctor, that you're the know all, tell all, and that it's a partnership for your wellness, as
yeah,
it should be. You do it together. You discuss
yeah,
things.
yeah.
It
There's
needs to change.
Yeah, there's definitely been this hierarchical stance that it's like, I'm the doctor, I know everything. You're the patient, you know nothing. And so you're lucky as the doctor. You're lucky that I'm even seeing you, right? And so then I'm going to tell you what my opinion is, and if you don't like it, kick rocks, kind of thing. It's like, what, And so I think a lot of times when a patient comes to a provider like me, they're bringing all that medical trauma. So medical trauma is actually called iatrogenics, and I test for it with people. And so they bring all that medical trauma, and because it's a new experience and it's a safe space, they tend to dump a lot of that, right? So the mistrust comes in, wanting me to, jump through a million hoops to educate and, re-educate and explain, and, all the things. And then a lot of challenging of ideas, and, combating with Google. And so I think there's also, on the patient side as well, I think there's also a lot of healing that has to be done too. But I understand why the patients are so on guard, because they have dealt with providers who just frankly don't listen and are very dismissive and very rude and almost violent in their communication.
Yeah, I've worked in healthcare for 20 years doing marketing. And in the health system side, I think that we need to revisit the patient rights brochure and rewrite it for the population today, which is a melting pot of immigrants and minorities and people with different religious beliefs from all over the world,
Yeah.
instead of just regurgitating what's been said for the past 50 years, which is what it
Yeah.
does today, and say
Yeah.
you will be listened to, and your will be honored and incorporated into your plan. We have a long ways to go.
Yeah, indeed. I mean, yeah, I don't, obviously being a holistic doctor and being an international doctor, I treat people from all different cultures. And I mean, you have to get a pretty quick study, on some of these things, because some of them can be wildly different and I mean, all of the different sects of Christianity, I never had, from the super fundamentalist, like we're not wearing, pants kind of fundamentalist, all the way to, more spiritual and more, esoteric and, all the things, right? The universe and whatever. And so I'm very mindful and very conscious of, making sure that I match the communication with the patient. Obviously I'm not Christian. I didn't grow up Christian, but I have people that have been Christians for a long time who I go, hey, can you give me, some scriptures on this and this and this, and they are happy to share. So it's been really cool because I've been able to learn about, all different sects of Christianity, obviously Judaism, but I grew up with that. Muslims, treating all different types, of spiritual people, Native Americans, obviously, and, other African spiritualists. And yeah, it's really cool. Like if you allow yourself, I think really every doctor should have a public health degree, because it really teaches you about different cultures and how different cultures view their health. I really think it should just be a part of education for sure.
Just as nutrition should be part of it too.
Yeah, and psychology and communication.
Right. Right. It'll be
People
a 10-year
skills.
degree instead of an 8-year degree or whatever.
Yeah.
Let's talk about commercial insurance, the evil elephant in the room. I read that whites are 7% of whites are uninsured, but 11% of blacks are uninsured, which doesn't surprise me.
Yeah.
And that also creates barriers for healthcare. If you don't have insurance, it's so expensive. I mean, even going to the doctor with insurance is 20, 40, 60 bucks out of
Oh
pocket.
yeah.
So
Yeah, and now they're even requiring screenings to be pre-authorized. So that could easily mean that, it can be declined, so your colonoscopy, that's totally, you're 50 years old, you need your colonoscopy, you need your mammogram, your bone density, those could be, oh, well, we're going to decline. And so I think it was, who is it? I think it was Thomas Edison. He had that quote, either Thomas Edison or Thomas Jefferson. I can't remember, one of the Thomases. He said, the doctor of the future will give no drugs, but will interest his patients. And yeah, that whole, very famous, right? He actually said that because the first HMO, the first in health insurance, was being implemented. And even the founding fathers could see the trajectory of insurance. Really, patients are very frustrated with their providers. And a lot of times it's really the health insurance companies that are pulling the strings in the background, that are saying, no, you can't do this, you can't do that, you have to do this, you have to do that. And, it's very unfortunate. I know for me, I came out of because obviously in school you're taught, health insurance is like, the pot of gold at the end of the tunnel. And then getting out and being in the practical side of health insurance, I wanted to be self-employed from day one. And so going through all of that process, and then right smack in the middle of that, we have healthcare reform. And I was like, no way, right? Like, and I think my straw was when one of my cancer patients who had lymphoma was denied for a PET scan, right? This is not a elected procedure. This is something, a diagnostic tool that we need to see if their treatment is actually working or not working. And that's an over $2,000 diagnostic scan. And so here you're paying in all of this money. And I think that's the social and financial and economic disparities alone, right? The cost of health insurance for minority communities when they're really just fighting to put food on the table. I think, and also too, I also have seen, even if they go on, let's say, state funded in health insurance, right? The the treatment on state funded health insurance is far less. And also, too, there are certain mandates on state funded insurance. So they go, oh, you haven't gotten XYZ recommended schedule. Oh, so it's all part of this kind of overarching system where it's like it's really become more of a mechanism of control than actual care. It's like, oh, we're going to give you health insurance, but you have to make sure that you do all of these, you have to do all the inoculations, you have to put the metal in the mouth, you have to comply, if you will, to the recommended CDC standards. And if you don't, then you risk consequences for that, i.e. losing insurance would be the least of it. But also too, now we bring back in CPS, and so it's just, it has really become quite tragic. And so, and again, I just don't think minority communities inherently trust the health insurance or the healthcare system in general, because let's face it, it wasn't built for us. It really wasn't. I mean, we were seen as, and in some people's eyes, sadly, we are still seen this way, as second rate, second citizens. I was on what was I on? I was on some sort of like podcast or something similar, like a TikTok live or something like that. And a woman actually said that we are subhumans and need to be monitored. In 2024, this is what is being said, and so it's I guess it's one thing to have a thought like that, okay? It's a whole nother dimension to go in a public forum and say, articulate those words out loud to an audience, right? There's just, and I mean, of course, I'm grateful that people are calling themselves out these days. It makes it a little bit easier, but geez Louise. So, but that was been the mentality. I mean, even Carl Jung, who I just love his work, saw us as primitive and primates, like what? So we have a long way to go for sure.
Definitely. I'm so sorry that happened. My girlfriend is very into metaphysical elements, and she said 2024 is the year of the reveal. It's a feminine divine rising to the
Yeah.
top, and all of this crap is going to come out, and it is
Yeah.
obviously.
Yeah.
Hopefully, we can wash it away and move on
Mhm.
as equals in the future. It's
Yeah.
absurd.
Yeah.
Um, I know that you also work, Dr. Steele, with people with mental health issues
Mhm.
of various things. As far as mental illness and uninsured, it's even higher than commercial uninsured stats that I shared just a few minutes ago. Adults with mental illness who are under or uninsured, blacks are 39% uninsured, Hispanics are 36% uninsured, and Asians are 25% uninsured. So the Black population definitely gets hit the hardest.
Yeah.
And how, I mean, you're just one practice in St. Lucia,
Of course.
and
Yeah.
you're
Yeah. And I
probably
don't,
full.
oh yeah, and I just treat virtually,
Mhm.
primarily in the States, but I do treat in other countries. I don't actually treat people here in St. Lucia. I will eventually, and we can talk about that later. But there still is very much a stigma, in the Black communities about mental health. There's still very much an aversion to seeking mental health. I think it's improving. I think that it's a slow progression. I think that um, more people are bringing that to the forefront. I think a good way to see that is in your popular television shows as well. So don't judge me, but I like watching Love Is Blind, right? It's just I don't know, it's nonsensical. A great way for me to turn my brain off. But what I was really surprised at this season was you did have Clay, who is African American, talking about mental health and talking about going to mental health. And that has not been a conversation that we've seen on TV, and we definitely haven't seen on TV from somebody of color. And so I think that's encouraging, to be able to model that behavior, that it's okay. I think you're still having we're still in this transition, right? You talk about that divine feminine and really coming into that own. A lot of the men that are still under that patriarchal model, which unfortunately a lot of Black men are still under that preface, and so it's very difficult for, I think, sometimes them to let go of their pride and their ego and really accept that they need help. But also too, there's a level of fear of vulnerability, and finding somebody to trust. I know in the mental health profession, Black male mental health professionals usually are booked out solid, just because they're in such high demand and it's necessary. So I do think there's a lot of disparities when it comes to that. There's not enough qualified providers, because if you're not trained, again, if you haven't done the work on your own unconscious bias and deconstructed that, it's going to be very challenging for you to be able to serve a patient of a different cultural background and be able to not cause any more harm. Part of also me doing all this education was because I was so deathly afraid of harming people inadvertently, right? And making sure that I'm very slow, very methodical, very intentional about even how I treat, because one thing can easily create something else. So I do think that there's probably a lot of reasons why that is. I think, again, cost, I think stigma, perception, also just a feeling of lack of safety, and not wanting to be vulnerable with somebody who could potentially harm you or your family or your professional career.
Yeah, the statistics show that an African American 31% would absolutely prefer, if they had the choice, to see a Black provider.
Of
It's
course.
just not, it's not a equal scale. Obviously, it's changing. I understand that there are organizations actively recruiting,
Mhm.
but you still have to have the means,
Yeah.
the support system,
Yes.
um, grants or finances. So I
Yeah,
don't.
and even too, like, think about it. When you've gone through trauma and you've gone through years of trauma, to unpack that is a very scary experience, right? And so also needing to have that support system on the other side to be able to assist with that. And one of the things I love is neurofeedback, biofeedback, and so it's so helpful to run a QEEG to see developmental trauma on the brain, to be able to allow for greater executive functioning, to allow for the mind to get out of that reactive state, right, from a neurological perspective. And the access to that is so limited, let alone the awareness and education that it exists and what it can do. So, I mean, there's so many different treatments that are available. However, there's this balance of, you know, uh, oh, well, that's not, FDA, blah, 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 blah. Oh, that's not, the standard of care. That's not la, 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 so there's a lot of resistance around people actually getting true health care too. So,
Yeah. I hope anyone that's listening to this, at least the takeaway, one of the takeaways of many of this conversation, is that you have the choice to have a well rounded health team. You can have your primary care doctor for your bladder infections and your sinus infections or whatnot, but you can also have a Dr. Steele for the cultural match and empathetic understanding of where you're coming from or trauma. And I have learned hard to have, 5 doctors in my arsenal, because one
yeah,
isn't going to meet all of my needs.
no,
And you have to do dialing for doctors, which is what I had to do last week. I was dialing and dialing and dialing to find a hormone specialist who could take care of my needs while mine was having a baby that was holistic, but also had the choice to prescribe. And it was a nightmare. I felt
yeah,
like I was on a telethon, just dialing and dialing and dialing.
yeah,
But there are people out there that can help you, that will be your advocate if
yeah,
you look hard enough.
yeah. And
I have
I
been
think
following.
it's good. Go ahead. Yeah, I think it's
Yeah,
growing.
I've been.
I think there's more consciousness to it now. Mhm.
Yes. There's platforms that are starting up that I've been following, but they're still in the infancy. One's called heal.me, where you can
Oh,
go online and search for your provider and put in the tags. I want, an obstetrician that's works with minorities, that lives in
yeah,
this quadrant of the United States or whatever. But we still have a long ways to come. It's mostly word of mouth.
Yes,
I
it
just
is.
was so lucky to stumble upon your LinkedIn profile and say, who is this doctor? And look at all of her credentials. And you definitely fit into the wellness whisperers genre and a mentality of, yeah, if we remove the obstacles, we can heal.
Yeah.
If we work with the right providers that understand us and can give us that guidance, we can heal.
Yeah.
But it's a lot of work. So,
It is.
how, if someone wanted to work with you, Dr. Steele, how would they, what's the best way to get a hold of you?
So I'm on pretty much every social media you could possibly, Dr. Erica Steele and Holistic Family Practice. And you can go to my website as well, holisticfamilypracticeva.com. It has a VA as in Virginia.com at the end. And my practice is completely virtual now. I send you to labs if you need, a lab draw, or we send a test kit to your house. Or if we need to compound a nutrient, we compound it and then it's shipped to you directly. So I've worked for several different years. I think for me, I saw a growing need for highly trained holistic providers. There just is not enough, and a lot of that is still, we're still kind of healing from the Rockefeller era, if you will, where a lot of holistic providers just were lost their lives, or were pushed out of practice, or were ridiculed, publicly shamed, stripped of their credentials, etc. And so you really have to be a brave soul to want to be in that. For me, I never have seen the pharmaceutical industry as an adversary. I actually see them as an ally. I'm not trying to get rid of anything. I just want a seat at the table. That's all it is. And so it's a very different thought process and mindset than some of the other who are like, super gung ho, and the evils of I just believe there's polarity for everything. And so I really decided to, I also felt like being in Virginia, I just was suffocated. And so that's also why I left the States, and left specifically Virginia. I mean, I've lived all over the United States, but and really coming to St. Lucia and working on building a school here to treat people and teach people. And if we thought that our healthcare had some challenges, the St. Lucian healthcare system is, I mean, they've only been free from the Queen for 45 years, so there's still a lot of infrastructure. So being able to build a school where we educate, American, holistic providers in a hybrid style, which is like part online and part, they have to come to St. Lucia, during their program and train with us. And, because everything grows here from noni to, I mean, you name echinacea, so we can grow and teach. And then being able to, treat the people here so that they are not missing in their healthcare. And so for me, it was more global. I really saw my work more on an international stage than just a national stage. But you're right, there it is very much still word of mouth. I'm hoping to get more structurally trained holistic doctors, because the other issue that we have is the lack of education and the lack of standardization in our education. You can have one quote unquote holistic practitioner who's literally done no sciences whatsoever, and they only have gone to like an herbalist program, or a weekend crystal healing seminar, right? And nothing against that, like I love all the things, right? However, we in order for us to be legitimate, we need the biosciences, your biology, your chemistry, your biochemistry. I use biochemistry every day. We need that information. And so really having the structure of the science to back all of the other things that we're doing, the natural parts. And really the natural parts are not that crazy. We're primarily public health educators. We're teaching people about nutrition. We're teaching people how to manage their emotions. We're teaching people, what herbs that they can use, what supplements they can use. And if you're a good practitioner who's had their chops, you don't over supplement people. You don't give them a whole ton of herbs and supplements or whatever. And you don't give them thousands of dollars worth of testing either, because you understand how to use, the resources that you have, i.e. your basic blood panel, and be able to treat from that. And so I just found a calling that we do need more practitioners. We do need more access. And so the only way for us to create that, at least from my perspective and the American Naturopathic Association's perspective, was to build a school. And so that's where we're at right now. So
Well, I am so glad to have you on this podcast. I've never promoted financially one of my podcasts, but this one I might boost because during February, Black Awareness Month, History Month, this is important. There's got to be some systemic changes so we all can get better and stay better and be happy in this world and work together. And anyone out there considering going into functional medicine or holistic care, I think Dr. Steele serves as the perfect model to follow in her footsteps. You don't have to get 6 degrees, just get
no. Yeah. Just your undergrad and your grad, I'll synthesize. I always like to say, I went to school so you don't have to. Like, I love school. I'm really good at school. School is pretty easy for me. And so don't hate me. But, having a teacher and having a person in healthcare, come on, I love school, and it's always been just an area of my life that's been really fun. But you don't have to go through all of that training for sure. And again, if you want to pursue this path, definitely look me up, because I mentor people, I help people, even people on the conventional side that are wanting to come over to holistic, because the challenge with them is they're bringing that diagnose and manage model with them. And so we don't want to just diagnose and manage it using a natural substance. We actually want to teach people how they can heal themselves using nutrition, using breath work, using, just cognitive behavioral therapy and all the different things that we've learned to be able to help people. And it's really, like you said, it's an all hands approach. It's an all specialties approach. I'll send to a cardiologist, I'll send to an endocrinologist, I'll send to, oncology, I'll send to different providers, and they send to me. Rheumatology sends to me, endo sends to me quite often, cardio sends to me, so we're all, we all have our perspective and we all have our pieces. And if we could just let go of all the rhetoric, right, and begin to come together, it's not I'm right and you're wrong or vice versa. It's that we have a healthcare epidemic. We have chronic disease is at an all-time high, and patients need us. They need us to put our egos aside and come to the table with solutions, not more problems and not more rhetoric and not more finger pointing. That's not going to work.
Amen. And my hope is that one day, not that I'm wishing you off the planet, Dr. Steele, but one day I see you on a stamp as the woman who led the charge for making healthcare access equal for all and just changing the whole evolution of medicine. So you just keep doing your work, and I wish you well with your MBA program.
Yes,
so thank
definitely.
you for being on the show. I so appreciate it. And I'm so glad that we got to share this message today.
Yes,
Thank
likewise.
you. All right. Bye.
Whoa.